Today I have privilege to have Dr. John Murphy here at Healing Hands Clinic, Pune. Just to introduce Dr. John Murphy, he is the innovator of three-dimensional mesh repair for hernia surgery. He has performed more than 3,000 cases, and he is the one who introduced this technique in India way long back. But then he made some modifications, and then today he is there with a Profloor technique for three-dimensional mesh repair. We had the opportunity to invite him here at Healing Hands to perform few surgeries with us. Since last 3 days he is there with us. He has performed more than 15 surgeries in last 3 days, and in coming 3 days we are going to perform more than 15-20 surgeries. So I would like to introduce Dr. John Murphy here.
Thank you.
Thank you. Thank you.
Pleasure to be here.
My teammate Dr. Paresh Gandhi, he is a hernia surgeon, and he is also specialized into laser varicose vein treatment. He is the assistant Dr. John Murphy for all his cases. And then I have my editor with me who will be asking us some sets of questions to take the discussion ahead.
Thank you.
Yeah, Dr. Murphy, my questions will more focus on your work on 3D measurement. So before I proceed to that, I'd like to know more from you about your journey so far.
Well, I've had the opportunity actually to travel quite a bit. Japan, Kuala Lumpur, Taiwan, China, India. This is my 4th trip to India. So I feel very comfortable being here.
Oh, great.
I enjoy it very much. As far as hernias are concerned, it's been a passion of mine for almost 40 years. And I've seen a lot of changes, seen a lot of different techniques, and each one has been an advancement. We know more about hernias today than we ever did.
In fact, I would like to give an insight into this. Last month we had a Freedom Hernia Week.
Okay.
We usually celebrate this Freedom Hernia Week every year.
Okay.
This time, out of 80 patients which came to us, 15 were having chronic joint pain, and they were operated earlier for hernia repair.
Oh, so Dr. Murphy, the things entirely boils down to the recurrence of hernia after post-surgery. Right. So what is the rate of recurrence when we use this implant?
It's about the same, 2%.
Okay.
2%.
So there are various papers which have been published.
Right.
There are series which mentions 4 to 5% recurrence rate.
Right.
Simple mesh repair, Lakenstein simple mesh repair. There are series which says 4% also. But in expert hands, the recurrence rate is hardly 1 or 2%, as is rightly said. And in my personal opinion, with this 3D mesh repair, till date we have not seen any recurrences in our series of 3,000 cases which we have done. So we have not seen any recurrences per se. And the best advantage that we see is chronic groin pain, something which is very common. The incidence is almost 15-20% with a normal mesh repair. In this we have hardly seen few patients, maybe the 4 or 5%, not more than that.
So do you think that the Profloor is a better and effective option for inguinal repair?
Yes, I do.
So could you please explain more?
Well, I think that basically we talked about it. The mesh is placed behind the layer, and there are no nerves, so that basically it can't entrap the nerves, it can't stretch the nerves, it can't injure the nerves. If the mesh is in the anterior space, then basically you're going to have a chance of entrapping the nerve, pulling on the nerves, damaging them.
So what is the complication rate in laparoscopy?
What are the
Why
complications?
the doctors are opting for open now?
In laparoscopic surgery, there are a number of complications that can occur which are unique or different from the anterior approach. First of all, you're putting trocars into the abdomen and you're putting them in blindly.
Blindly, yeah.
So when you put it, you may injure the bowel. I mean, that's the first complication you can have. The second one essentially is when you're in there, that space is defined a little bit different than what it is. It's the reverse, it's the mirror image.
One more thing, one important thing here, as is rightly said that the learning curve for laparoscopic hernia repair is more than 150. So what happens during this learning curve, the recurrence rate is sky high. What we have seen is the recurrence rate of almost 15 to 20% during the learning curve.
Oh my God.
So that comes at a huge toll.
No doubt.
And in India, what happened when this trend came in, it was started in 2005, laparoscopic hernia repair, and there was high recurrence rate during this period of 2005 to 2008. So that is where bigger disadvantage for laparoscopic repair. Wherein in three-dimensional mesh repair, once the plane or the dissection is clear, it is going to give us good results.
Right.
Exactly.
So creating that plane is a very crucial part in
Absolutely.
In his hands it's magic, so he just has to rub it.
It's very easy to do. It's extremely easy to do. The surgeons that we had yesterday, one was a young lady, young woman.
Dr. Mesh Hernia from
And
Jaipur.
she had never really seen the procedure before, but when we walked out together, she said, "Thank you very much. Now I know how to do it." So it's as simple as that. You know, it really is pretty simple.
And the level of chronic pain also goes down with this
Yes, absolutely.
Significantly.
significantly.
Yeah.
And that chronic groin pain is very discomforting, I think.
Yeah, true.
I mean, patients, they come with complaints of, doctor, something is happening in that area. Has my surgery gone wrong? Is there a recurrence? Rule out that. These are common questions. Sometimes this groin pain radiates to the thighs also.
Oh.
And that becomes very irritating for the patient.
Or into the testicle. Sometimes into the testicle too.
So how is this 3D mesh repair carried out? Could you please explain it in simple terms?
This is placed beneath the fascia. You can see it here.
Right.
Beneath the fascia. Here's our mesh underneath. And here's the dynamic implant, which is placed within the hole. So when we're done, we have this type of thing. We have mesh underneath.
Okay.
We have a dynamic implant in place where the hernia is, and it actually moves with the patient's movement.
How many surgeons you have trained so far in this?
Oh, probably thousands. I don't know. I don't know.
My God.
I don't know.
And
A
how
lot.
many in India?
A lot. In India, not as many yet, but that's one of our goals essentially.
That's what the goal is.
Yeah.
He has certified Healing Hands Clinic as Center of
Center of
Excellence.
Excellence. Is it the first of its kind Center of Excellence in India?
Yes, it is.
Yeah. And when we designate a center as a Center of Excellence, what does it really mean for common patients?
Yeah. They have to meet a certain list of criteria, first of all.
They need to follow that protocol.
Yes. And then basically, that's why I'm here essentially, is to visit and take a look and make sure that everything is okay. Now we've had 1, 2, 3, 5 surgeons here in the last 2 days. We have another surgeon coming tomorrow
From Delhi.
from Delhi, and one from Jaipur yesterday. So we're trying to educate them and send them out into their hospital, into their community,
Okay.
with the information they need essentially to do the procedure.
Great.
Yeah.
By the way, the kind of presentation of inguinal hernia you are seeing here in Pune, how do you see it in comparison with the kind of hernias you've been treating in your country?
Good question. The hernias that I've seen in the last few days are more advanced. They've been there longer, they're bigger, and frankly they're more technically difficult. Yeah, because they've been there for years and years.
Oh my God.
Yeah.
Awareness in our country is less.
Less.
So patients come in
Yeah.
advanced stage. And
Advanced
they
stage.
have early diagnosis, so in US patients are come early.
Oh.
The things in USA and India are slightly different.
Yeah.
Now, in India, laparoscopic surgery for hernia will cost you high, somewhere in the range of 80,000 to 1 lakh. Whereas in USA, since laparoscopy is now almost outdated, a 3D mesh repair will cost you same like laparoscopic repair.
Oh.
Simple mesh repair in India will cost you maybe around 20 or 30,000 rupees. With this 3-dimensional mesh repair, the cost comes to around 50-70.
Okay.
So it is 20,000 more than a baseline cost.
Okay.
And why pain is important here is, typically when a patient of hernia comes to you, he won't have pain.
Right.
He never comes with pain. He comes with a swelling.
True.
And we treat him for the swelling.
Swelling.
Later on he develops pain.
Pain, okay.
That is what he means when he say chronic groin pain.
Groin.
And that pain is bothering a lot to the patient because it's a nerve pain, neuralgic pain. It's like a spinal pain. The patient is having a spinal lordosis or some kind of disc prolapse. They'll have some radiating pain in the legs. So this is a similar kind of pain.
Okay.
So this pain needs to be tackled. And
Right.
there is where this 3D mesh repair comes into picture, because it is going to eliminate this groin pain.
We are
Yeah.
giving general anesthesia plus local anesthesia.
Yeah.
So it's as a patient will discharge in 4-5 hours only after surgery.
Right.
Varies. The
It
reason
varies from person to
the reason is, now we being a daycare center, we want our patients to go home in 6 or 8 hours. So general anesthesia is preferable because the anesthesia lasts only for 30 or 40 minutes. Now he prefers spinal anesthesia because they use short dose anesthesia, wherein the patient can go home maybe after 12 hours or 24 hours.
I think that's it from my side.
Thank you for asking me those questions.
You are here at Healing Hands Clinic with us for last 3 days.
Yes.
Probably this is your second visit to India, right?
Fourth.
Fourth visit,
Fourth,
right?
yeah.
But then before this, you were you in the operation theatre earlier?
Yes.
Have you been? Yeah.
Yes.
This time you have done a bulk of cases.
Yeah.
So how was your experience and what would you like to suggest us?
I have had a great time, and I had a very, very good surgeon assisting me and helping me.
Thanks.
And I've helped him on a couple of cases, and it's been a delight. I called my wife the other night, and I told her that it was so great to get back in the operating room. I was so happy. So I've had a great experience.
So that's great. Thank you.
Thank you for allowing me to do it.
Yeah.